Hi,
There we go.
Kelsey.
Hello.
How are you?
Good. I'm good to join you, Jules.
So what's the weather like today? You're in Hartford, right?
Yeah, in the cold. It's just like cold every day and cloudy. So,
Oh man.
yeah.
Well, it's raining today, so this is a very timely topic because whenever it rains, I feel a little sad and mopey and I don't know what to do. But we just really want to talk about coping with quarantine, and how this affects our mental health. And we'll just get right into it. Obviously, we're all in self-isolation right now. Some people might be quarantining with significant others or their families. Some people might be all alone. So, what can we do to really focus on our mental health and to better ourselves during this time of uncertainty?
Yeah, great question. I wanted to make kind of a blanket statement about how it's okay to not be okay during this time. So while I'm
Yeah.
going to talk about tips, tools, resources, I don't want anyone to feel like there's something wrong with them if they're having a really hard time, because this
Mhm.
sucks. Like, this is not
Yeah,
like,
it's not fun.
no, not normal at all. So I think my first tool is really trying to focus on the things that you do have control over and kind of letting go a little bit of the things we don't have control over, which I think sounds really easier said than done. But
Yeah.
if you make a list, you can put a list of all the things that you feel kind of helpless over and all the things that you feel like you do have control over, and then just devote your energy to the things you can work on, like nutrition, doing a daily walk, filling out your planner, maybe
Mhm.
building up your resume, depending on what kind of walk of life you're in. So that's
That's
kind of my
really good.
first tip. Go ahead, Jules.
So would you say like establishing like a routine, even though I know this routine isn't normal for everyone right now, like we're all in this together of this quarantine, so we kind of need to establish our own new routine.
100%, yes. And
Okay.
morning routines, I think, are the best because I don't know, you have to get up, but some people don't have to wake up
Right.
at 8 in the morning. So having like a mindful kind of morning can be super helpful to give you actual inspo to get up in the morning.
Yes. And I mean, even putting on makeup, like I'm making myself put on makeup every day because it does make me feel better. Makes me
Mm-hmm.
feel, like I'm ready for the day. All right. So, what are signs to look for in those that might not have ever dealt with a mental health issue, but they might be dealing with it now?
Mm-hmm.
And you're quarantined with them. You notice that they're acting a little differently. What are some signs to look for?
Definitely. So I always say anything that seems like a deviation from someone's normal. So some people are introverted and this is like the life for them. That's
Hmm.
cool. But if you are with somebody who's usually very extroverted, maybe likes to go to CrossFit 5 times a week, whatever,
Yeah.
and you notice now they're isolating in their room, they're ignoring phone calls, maybe they haven't worked out in 6 weeks, those are bigger deviations from someone's normal. And I do want to emphasize that there is a grief loss reaction to kind of what's going on. So
Okay.
if someone has lost a job or like postponed a wedding or had a baby but no one can see their baby,
Yeah.
having symptoms of depression is not unusual. Feeling down is actually a very regular response. So we don't even diagnose people until like 6 months into kind of a triggering event, if that makes sense.
Okay, so it can people be feeling those things for a short-term time and then,
Mm-hmm.
they're just kind of go away? Or
Yeah.
okay. So it's
But
it's completely normal.
if it sticks though, if you notice it's kind of going on beyond that 6 month period, or maybe there is no identifiable trigger, other things to look for that might be depression or anxiety are oversleeping. So someone who's not getting out of bed, maybe sleeping 12
Yeah.
plus hours a day, appetite changes. If they're talking about how they don't really have hope for life or like it's pointless to even do life, those are some bigger signs that someone's really struggling and might need more support.
Yes, definitely. All right, so this leads into depression. There's a lot of uncertainty in this time, and people are feeling depressed. They might have lost their job or maybe have lost a family member to COVID-19. What are some resources out there that people that are free resources?
Yeah,
Because, I mean, everybody is feeling the hurt in the wallet right now. So, what are some free resources?
definitely. So there are national hotlines that are completely free to call, and they are confidential. So I actually have the number written down for the national hotline. It's 1-800-273-8255. But you can always just Google national hotlines or call state hotlines. There's a really neat project for LGBTQ youth called the Trevor Project.
Yes.
Have you heard of it? They can text in too instead of call. So I think that's really convenient for some people.
Definitely, because sometimes people are afraid to have that, actually say the words out loud and have that conversation out loud. And sometimes texting is a little bit easier and more comfortable for people. Because, I mean, how many times do we just text throughout our day? It's normal for us.
Yeah.
So I get that. That's so great. And then there's also this stigma surrounding mental health. People might think that they're weak if they reach out and ask for help, but that's just not the case. I mean, you know, so many people deal with struggles. So what would you say to somebody that thinks that there's a stigma surrounding mental health?
Yeah, I think that is such a good question to ask, because I think everyone has internalized stigma to different levels, but it differs based on where you grew up. So if your family was super open into talking about mental health, you're more likely to feel comfortable with it. But if you never had access to those resources, it's kind of a weird concept at first.
Yes.
So I always try to talk to my clients about the difference between physical health and mental health, and how if you broke a leg, you go to the hospital right away. So why don't we treat our mental health the same? Because it's tied into physical health, like very, very strongly.
Yes, 1000% agree. Because it's like, if I, you know, break my leg, I'm sure as heck gonna call my doctor. But, you know, don't sit there and feel like that you're having a mental health struggle. You're feeling sad for like months on end and you're afraid to do anything about it. Definitely speak up. So that ties into self-care. What are some good self-care practices that can help our mental health?
Yes, and do self-care all the time. Like, the most common thing I hear is, I don't want to be selfish. Like, too many people need me. But you really can't care for someone if your cup is like only 25% filled.
Yes.
So self-care can be anything that you have access to. That right now is social distancing, which there's plenty. There's lists online of coping tools. A few of my favorites are like cooking, baking, Zoom workouts with my girls. I'm really into that lately.
Yes.
It's so fun. Journaling, coloring, and there's so many apps right now for meditation. Have you heard of Headspace before?
I have, yes. I've not checked it out.
So
what's that about?
I love it. It basically walks you through mindfulness meditations, and there's a free version that you can start with. And then for college students, a lot of college students I think can get it really, really discounted. But there's also apps such as Insight Timer, Pacifica, Calm, and they all teach you how to meditate, which is super, super important during this time when we all want to ruminate about the world and what's going on.
Yes, that meditation is a good escape. I've never really meditated, but you know, something that I find is fun for self-care is just doing something for myself, maybe taking a bubble bath, even like doing my nails. Like, I don't know, like that kind of stuff, even though somebody might think that that's work. That's kind of how I self-care, like treat yourself and kind of spoil yourself a little bit.
Yes.
And what are some more resources? Do you have any other resources that you want to tell us about?
I do. And I want to give resources that are not, like, I'm not affiliated with any of these. But psychologytoday.com is a great starting point, because you put your insurance info in, you put your city and your state. Since we're all doing online right now, you don't really need to live that close, but it needs to be the same state. And you can look up therapy providers in your area. Super helpful. Yeah, me too. And there's other online options as well, but I usually refer people to Psychology Today because they have their bios on there. And then a fun fact that everyone needs to know is a lot of insurance companies are waiving copays because of the pandemic.
I had no idea that was a thing. And that's huge.
Yeah.
That is huge right now.
Sometimes you need to call. Sometimes you need to call and be like, hey, I'm stressed because of the pandemic. And then they'll do it. But if you call your insurance company, they should always give you a list of providers. And if they're not helpful, if you call again, you'll probably get somebody else. So just like try to be persistent.
Yeah, I mean, sometimes you just gotta be super persistent to make it happen. All right,
It's hard.
Thank you so much for, just hopping on Instagram Live to help us cope with quarantine. Really appreciate you taking time out of your day, Dr. Kelsey. And then where can we connect with you?
Yeah, I have an Instagram, Dr. Kelsea Visalli, and then I think it also links. I'm trying to do new YouTube videos for coping with mental health, so you can comment on there.
And it's an @doctor with a dot Kelsea Visalli, right?
Yes.
All right. Well, thank you so much, Kelsey. I will be talking to you soon. Bye.
Talk to you later. Take care.
Bye.